My name is Dr. Jeremy Kinder. I'm an orthopedic surgeon at Panorama, specializing in total joint replacements. Working mostly with patients with arthritis with hip and knee replacements, as well as some revision work for failed joint replacements and infections. I grew up in the Midwest, right outside of St. Louis on the Illinois side. It was a very rural community. A lot of my childhood was spent actually working on farms. My grandparents owned a farm. I worked on their farm. We had friends that owned a farm. My dad used to work for Ford. I used to hang out in the garage with him, and I loved playing with the tools. And orthopedics is just kind of glorified mechanic work or carpentry skills. And he has restored several cars himself, and that kind of rubbed off on me. So after I got done with all my training, I got a 1970 Mustang that my dad and I put back together. It's fun being able to take something that's broken and be able to put it back together, or something that doesn't look very nice and be able to get it into a more polished appearance. A friend that had an ACL surgery that I thought was very interesting, and I had my grandfather ended up having to have a knee replacement, which totally changed his life. So early on, I wanted to go into orthopedics. I did medical school at Rush, internship in general surgery at Northwestern, as well as my orthopedic residency at Northwestern. Then I went to Rush for my joint reconstruction fellowship, which is an extra year of training. And there worked with a lot of great surgeons who were pioneers in minimally invasive surgery. You do the incision as small as you can with still being able to see the procedure, do the least amount of tissue damage as possible, and just so that the patient has a better outcome, faster recovery, and less pain. With that, it gave me a very unique approach and a unique ability to see things and have to kind of sometimes think outside of the box to fix the problems that patients had. When it comes to first go-around primary joint replacements, I don't feel there's a lot of situations that I get into that I can't get myself out of. My philosophy of care for patients is making sure that patients are participating in the decision-making process. You try to present as much information as possible so everybody can come to a good collaborative endpoint. A lot of my free time, as well as my wife's free time now, revolves around our kids. We have 3 young kids, 8, 5, and 2, and they keep us going most of the time. My daughter's now into lacrosse, which is a lot of fun. Even though I don't know anything about lacrosse, I still feel that I get very competitive about it, even if I don't know what I'm telling her whenever we're yelling on the sidelines. But it still is a lot of fun. We like to try to be outside as much as possible, even if it's just around our house, out in the parks. We do try to go hiking. Our 2 oldest are now skiing. Just seeing the joy in their face, it makes it all worthwhile. I think the thing I'm most proud of is just the patient-physician interaction. Being able to connect with a patient and being able to take them from, if it's just from severe arthritis, to giving them a good joint replacement where their quality of life gets better, versus someone who's had a failed joint replacement and hasn't been able to walk, and you can do a surgery to them where you can get them back to, even the simple thing of walking can be an amazing result for someone who hasn't walked in years. And being able to see patients doing well and hearing their satisfaction, I think is by far and away the most rewarding aspect of what I'm able to do.